listeners, you have to start with the understanding that there are many people trying to sell you stuff, people with ideas that are not evidence based, that really have nothing to do, that don't understand the foundation of health, who will say things, but just because they're saying things. And some of these people even have MDs after their name or, other kinds of degrees. It doesn't mean that it's correct or it's the truth or it's evidence based. Just understand that. The wonderful thing I like about lifestyle medicine and the group that we are in, right, which is lifestyle medicine, whole food, plant based, is that it's highly evidence based. So I'm going to answer the question that you just asked from it's all evidence based. It's not my opinion. It's not whether I like eating something or I don't. It's just that's what the evidence.
As our speaker who's going to be answering questions today, we are fortunate to have Dr. Ron Weiss. He is certified in internal medicine and in lifestyle medicine. He is a primary care physician in New Jersey, and he serves as the executive director of the Ethos Primary Care Center and as a assistant professor of clinical medicine at Rutgers, New Jersey Medical School. He's not only a physician, but he's a botanist and a farmer. Now that's different. We're going to learn more about that today too. But one of the things he finds great joy in is I've heard him say in the Eating Us Alive introduction that's part of that documentary, if you have seen it, is he talks about the joy of helping his patients cure those chronic diseases and prevent them. We like that a lot. So I wanted to investigate, is he for real? Is he really that? Well, he is. One of his patients, this is what his patient said about him. During your appointment, you will sense that Dr. Weiss is fully present with you, not only as your doctor, but as a fellow human being who genuinely cares about your well-being. Now that's a pretty good doctor. And I've seen that because you too have probably seen him on Chef AJ, where she has a regular program that he comes and answers questions. And so he's going to join us today. So how about coming in, Dr. Weiss, and let's find out some more from you. Welcome.
Thank you for such a warm and hearty welcome. Great. And your kind words. I really appreciate it. Thank you so much.
Well, we're welcome. We're glad to have you because we have some good questions today. And before we get started, though, I think it's kind of important for us to find out, what led you to being lifestyle certified? What led you to using plant-based with your patients?
I am a traditionally trained physician, but academically trained from Rutgers, New Jersey Medical School and George Washington University Hospital, where I did my internal medicine training. And, during the course of my professional life, first through an experience I had with my dad, who had dramatic results in temporarily reversing his pancreatic cancer with food. And then through other experiences I had, I began to realize that the current paradigm of medical care which exists wholly or pretty much almost entirely. It exists in basically just giving people medications to treat chronic problems like high blood pressure and diabetes and heartburn and asthma and skin conditions like eczema or psoriasis and psychiatric conditions like depression or anxiety and bone conditions like osteoporosis and diabetes and overweight and cancer, and the list goes on and on and on, which is why, because of these things, that's why people end up in doctors' offices anyway, right? I began to feel that this just wasn't the solution. Just giving band-aids or drugs to sort of paper over what the problem was without identifying the problem's cause was just not good medicine. And as I began to find along my path amazing experiences of first my own dad and then my other patients, where they would be able to overcome these problems just by changing their food and changing the way they moved and other things, it sold me. And today, the collection of all of these areas of attending to one's personal habits and behaviors in a healthy manner is called lifestyle medicine. It's the newest kind of doctor on the block. It is a board certified endeavor, just like you'd go to a board certified dermatologist or board certified plastic surgeon or a board certified kidney doctor or GI doctor, orthopedist. You can come to a board certified lifestyle medicine doctor. And what we do is, because it is so effective, the most effective at almost every disease that there is, at reversing and preventing it, we utilize a patient's habits to prevent and reverse their diseases. And one of the primary good side effects of doing this is the riddance of a lot of medications. And so this kind of habit is called deprescribing or de-escalation of medicines. And who doesn't want to take less medicines, Kathy, right?
Gosh, you are so right. That is what we would love to do, is to be able to have that happen. And as I listened to you, I was reminded of what Dr. Amber Orman, I don't know if you know her, she's an oncologist.
I do not.
She's the chief wellness officer, the very first one they had at Advent Health in Florida. And she's talked about how doctors don't know what you know. They don't know, many doctors, they don't know about the power of whole food plant-based. And they don't know how to make it happen because they don't know how to do it for themselves. And
well, I think you're very correct. I think there are two issues. The first thing is that doctors are not educated in nutrition. Like when doctors have to go to medical school, and when you go to medical school, almost all medical schools that I'm aware of, except maybe for a few very special ones, that have taken nutrition as their specific focus, like lifestyle medicine focus, but 98.9% of all the medical schools have not changed their nutrition education since I was there. And I can tell you that it's basically almost non-existent. You don't learn, the nutrition that you learn is basically reduced to, oh, you'll get scurvy if you're on a ship and you don't have enough vitamin C in the 1700s. Oh, you'll get pellagra. You'll get this disease, if you're eating polished rice. Oh, this is what vitamin A molecule looks like. But what does that have to do with eating so you don't get diabetes? Or if you have diabetes, treating it with medicine, with food as medicine, instead of drugs as medicine. This is not at all taught at all. And this is the foundational reason is, well, one of them, you can ask me about the others. One of them as to why we have our healthcare system crisis now, where everything is just beyond out of control, epidemics of diabetes, obesity, cancers that are rising, just all of this stuff. But the other thing, when it comes to doctors, I've realized is so I guess you can, it's not that I guess it's the system's fault for not educating the doctors, the medical educators. That's what it is, I guess. The other thing is that you alluded to this. I have found that um, if a doctor, if a doctor is not eating a diet of whole plant foods, a healthy diet that is disease reversing and preventative, and if they're eating, in another way, that the doctor will not be open to adopting this way and counseling the patients and using it as a form of medicine. And I think it makes sense to me. It's because, like, well, if I don't see in value for myself, why should I? If I'm not going to do this, why should I tell my patients to do this? It makes sense to me. I remember there was I had one of the best doctors I ever knew in my professional career, was a pulmonologist who was in the town that I had my old practice in, and he was a lovely man, my friend. He was an excellent lung specialist, and I used to send all my patients to him because he was so good with the patients. The patients loved him. And one day, once I found out, it took me a while, but I found out, oh my God, you know what? What I am doing with these plants, that can help asthma patients a lot, like prevent them from being hospitalized. Like they don't have to take prednisone anymore. Like they can get off their inhalers. I said, let me call up my friend and tell him this. I called him up. I said, listen, because I figured, well, I'm sending him whenever my patients need a pulmonologist, I send them to him. I figured, well, let me see maybe if he has some really difficult cases. Like there are some patients who have so difficult with the asthma, like you can't get them off any steroids. They're on steroids constantly. So I called them up. I said, listen, if you have a person who you don't know, you're scratching your head, you don't know what to do with them. They're on prednisone every day for years, which is not a good thing, right? Why don't you tell them about me? Let me have a try. Maybe they'd be willing to change their diet because this is really powerful, Greg. He said, oh, Ronald, yeah, I know. I know vegetables, eating vegetables. Yeah, I know that's good for you. But who's really going to do that? Who is going to actually going to eat like that? And so I never saw anyone from him. And he was my friend. It's not like he would, he wasn't hostile to me. He was a lovely man and wanted to help me. But he himself did not, because I know he didn't. I know he ate just a regular omnivorous diet. And about 8 months later, I called up his office and spoke to his office manager for something for a referral for a patient. And she answered and she heard my voice. She started crying. Maria, I said, Maria, why are you crying? She said, the doctor is dead. I said, what? He was swimming in the Gulf of Mexico. He went on a vacation in Cancun and he had a heart attack while he was swimming and the whole community was bereaved and was very traumatized by his passing. And so it makes me think to this day that he could not see the value of this because he wasn't. It's not something that he could experience, or because of his own biases with food. he couldn't transcend that. And I feel very bad to this day about his passing, but I remember that story, and I do feel that unless a physician is really eating like this, him or herself, I think it's not going to be something that is going to be proscribed to help a patient overcome their problems. It's not, because you have to walk the walk. If you're going to talk the talk, you have to walk the walk. Doctors have to be models for their patients. And although none of us are perfect, we have to try and embrace what we know the evidence shows is disease reversing and preventive.
That reminds me of what Dr. Kim Williams said when he talked with us on Zoom. He said, it was that famous quote that he's known for: my job as president of the American College of Cardiology is to do something about the fact that the majority of physicians are just like the public. They die from heart disease. And
the number one cause of death of cardiologists is heart attacks, a completely preventable problem. That is crazy. That is crazy.
Yeah. Oh, I'm so sorry about you.
I mean, if I told you that the number one cause of death of pulmonologists was lung cancer, or the number one cause of death of GI doctors was colon cancer, wouldn't you begin to think something is not right here with the way these GI doctors are living, or pulmonologists are living? Why isn't it true of cardiologists? So I understand that that's why he had such a, he's a force to be reckoned with. I still, one of my favorite lines of his was, there are two types of cardiologists, right? Plant-based cardiologists and those who have not read the data. In other words, those who are ignorant.
Yeah. He says it well. Okay, so why don't we get to some Q&A then, as it deals with the news, the recent news, things that our members are hearing. The first person asked, what's so bad about seed oils? To eat whole food plant-based, no salt, oil, or sugar. We don't use oils anyway, so it's kind of a non-topic for us. But why do we hear now that everybody else is saying they should avoid it? And one male in our group said he heard a nutritionist say that if the diet is low in fat and high in carbs, you will have high triglycerides.
The first thing to understand, there's a lot of people saying a lot of things. We have this thing called the internet. I'm often, I chuckle. It's like kind of crazy. I like going, a lot of us use YouTube. I don't know if you do, Kathy, because you can learn a lot on YouTube. Like I take a little video every night about native species, and whenever I watch it, it's so calming to me. In this troubled world that we live in, I learn about the 7 different kinds of goldenrod, and what their peculiarities are, and how are they related to one. It's a nice subject. So I'm on YouTube and I'm watching these, and they have these such crazy ads, like, did you know that if you do these eye exercises, that you will grow hair again? Here is the secret to doing, these kinds of things, where it's completely irrational. That processed foods are not good. Eating a lot of chemicals is not good. Eating whole foods that have been processed, like seeds, that have been put into a factory, and then you extract all the fat with them with chemicals and bottle them and whatever, and they're enormous sinks of calories for people who eat them, who are obese and have died. That's not good. He's right. He's right. It's not good. We have an obesity and overweight crisis in our country, right? Um, I don't know. I can't keep up with the figures anymore. I think it's well over half, if not somewhere between half and two-thirds of our country is either overweight or obese. Oils of any kind are the most concentrated source of calories, right? In in existence. If you give me a tablespoon of oil to eat, any kind of oil, I don't care if it's extra virgin olive oil, if it's a seed oil like sunflower seed oil, or if it's coconut oil, I don't care what it is. It has many more calories than a tablespoon of meat. I mean, if you know, why would if the majority of the country is interested in attaining a normal or more healthful weight, we wouldn't want to eat large concentrated sources of calories, and the largest is oils. So right there, to me, that's the number one reason not to eat oil of any kind. I don't care if it's seed oil or whatever oil you eat. Here's another reason. Oils are junk foods. When I say junk food, what is the definition of a junk food? A junk food, what do you think of when you think of a junk food, Kathy? Give me an example.
Well, I would
Give
think
me
of
a junk food.
Dr. Hound Steele told us it comes in a package all crinkly. He said
Yeah, but let's say I took off the package. Give me three different junk foods you could think of. Like if you told your kids that's junk, no, I'm not, I don't want you to eat that. What would it be?
well,
Give me
there's
some examples.
salty ones like chips and crinkles and
Chips.
yeah.
How about ice cream?
Oh yeah.
How about candy bars?
Yeah.
How about candy like jelly beans? How about like donuts? How about cake? So basically, the thing that binds all of these together in a category
Mm-hmm.
is that they have huge amounts of calories, right? And very little nutrition. That's what determines that they're junk foods. Large amounts of calories, almost no nutrition, right? Ice cream, cake, donuts, candy, potato chips, right? Jelly beans. I mean, isn't that true?
Yes.
So now let's look at a tablespoon of olive oil or a seed oil, any kind of oil. It has many more calories than a tablespoon of any of those foods that I just told you about. So it even exceeds their caloric density, right?
Mm.
What nutrients do they have? Almost none. How many vitamins do they have? Almost none. How many minerals do they have? Almost none. They have a macronutrient, they have fat. That's about it. That's what gives them their calories. Maybe you can make an argument that some like extra virgin olive oil has some trace phytonutrients left over from the olive, but you could just get that eating an olive. Like, why would you want to eat just the extracted fat with a shadow of these nutrients in it, right? It doesn't make any sense. And then you could argue that the other oils, like whether it be, the sunflower, the safflower, all these seed oils, they have even less phytonutrients. So, here's a third reason not to eat oils, right? So first of all, we talked about they make you overweight.
Mm-hmm.
And sometimes, Kathy, let me get back to that. Sometimes, they can turn out to be our own worst enemies despite our trying to help ourselves. Like, let's say you decide, okay, I'm overweight, I want to lose weight. What should I start eating? I'm going to start eating more salads. Okay, let me eat a salad every day. Okay, does that sound like a plan, Kathy?
Yeah.
Right? let me have a nice green salad every day. I'll lean into it. And you have the biggest salad you can. You do it every day. But on top of that salad, you put salad dressing with 2 tablespoons of extra virgin olive oil because it's so healthy, which is not a lot, you know, compared to what people eat. Let's say you're eating an extra big salad because you want to eat more vegetables, right? Because you want to lose more weight. So that's 120 calories per tablespoon. That's 240 just in the 2 tablespoons of olive oil, 240 calories you're eating every day. At the end of a week, that adds up to an entire extra day's worth of calorie eating per week just because so you think you were losing weight because you're eating more salads, but you actually gained weight because you're eating enough calories just from the olive oil, from this really healthy big salad. So you're eating an eighth day of a week. That's why we shouldn't do it. Okay. Last thing I was going to set before I derail myself, I was going to say is oils, most of the oils, especially the ones that are cheap and industrially made, are made with through oxidative processes. They're in machines and factories under high pressure, under high heat, and this damages fats. We don't want to damage fats. When we damage fats with the exposure to oxygen and heat, and open the seed itself from the seed oil and expose the fat, it oxidizes and then it becomes very unhealthy. So so exposure to these industrial processes and manufacturing the oil, and then just the oil degrades when oxygen, it's bottled with some oxygen, or you open the bottle and then oxygen gets in, and then over time there become very unhealthy radicalized substances or pro-oxidative substances that this oil starts to cause damage within our body. That's another reason why you don't want to eat. The last part of your question that you asked is, well, someone said, well, don't eat too many carbs. That's going to raise your triglycerides, right?
Right. If it was low fat.
That's not true. That's not true. Well, the first thing to remember is I don't see, we have to get away from the language of low carb. It's not, you know what plants have, what food has carbohydrates? Plants have carbohydrates. All plants have carbohydrates. And animal foods do not have carbohydrates. So when the average person tells me, or this advice that, oh, go on a low carb diet, it means a low plant diet. It means a low fiber diet. And when you're going on a low plant or low fiber diet, you're going to be a sick person eventually. And the reason why is we know that plant-based eating is the foundation of health, right? Number two, we know that only plants have fiber in it. Animal foods don't have fiber. Processed foods don't have fiber. And so if you're not eating those plant foods that have the carbohydrates, which are hooked up to the fiber, you're going to have a low fiber diet and you'll become very sick. You'll have a bad microbiome. You'll get dysbiosis. You'll be overweight and get cancer and heart attacks and strokes. So you don't want to eat a low carbohydrate diet. I think that term is maybe confused by some people. And when I think they think low carbohydrate, they're thinking low processed carbohydrates, right? Like don't eat bread. Don't eat grains that are ground into dust and eat the dust. I get that, right? Or don't eat, cornflakes, or don't do that. I understand that, but it's definitely the whole starches, such as legumes and sweet potatoes and whole grains and whole roots. Those are carbohydrates which are in storage forms. They're called starch, as the great Dr. McDougall once called it. May he rest in peace, right? And they're important for human existence. So,
Got
yeah.
it.
And just to say, I don't, just because, and the person who gave that advice with the low fat it's a confusing message, because I don't think that people should have zero fat in their diet. That's not, because nuts and seeds are important whole plant foods. They are. They're really important. There are reams and reams of data showing that. So you can have adequate fat in your diet by eating whole nuts and seeds. You just shouldn't crash them together to get processed oils out of it. That's it.
All right, she's a 67-year-old female, recently diagnosed with neurogenic bladder and has to self-calf several times a day. She has constant numbness with occasional stabbing pain in the left thigh. She has had an ultrasound on her bladder, and she's had a lot of tests, but the doctor told her that sometimes this will just go away, this neurogenic bladder. She was tested for MS with an MRI. The radiologist said that it was a normal brain, but now her doctor wants to talk more about the MRI because she was concerned about something. She's on high blood pressure, drops for glaucoma, hormone cream, B12 supplement, cranberry powder, D3. She's plant-based, has been for 4.5 years, and she drinks a lot of water every day, walks for exercise, and babysits her young children.
How old is she?
67. Oh, and wait, I need to tell you one thing. She did have, at age 35, fibroid cyst, ovarian cyst, and extensive endometriosis, and that on the bowel and adhering to the fallopian tubes, to the uterus, etc. So she had a hysterectomy for that reason then.
Yeah. How much does she weigh? Does she say?
She didn't say. I think she's probably close to normal weight, a BMI normal weight.
Well, it sounds like a neurogenic bladder is a bladder that's not working. And it's not working based on the bladder is we have so many things in us, Kathy, that are so beautifully designed and operate without our ever knowing. You can pass through this life for a century, and these systems can serve you, and you never even give it a thought. It's not like, like the plumbing system, like, oh, I just have to urinate. Well, yeah, but there's a complicated system that allows you to urinate, and most of us are not even aware that it exists. And in this lady's situation, the bladder is a tank that holds urine, and it has this amazing system of nerves that supply valves that keep the urine from leaking out, which are activated to let urine go so that you can urinate. And then these are connected to your brain so you know when you should go to the bathroom. And there are all kinds of things. And neurogenic bladder means that her nerves are not working. The whole wiring system, it would be like if you had a well and you have a well pump, and you need electricity to get for the pump to get water out of the ground so you can drink it from your faucet. If there's a blackout and there's no electricity, all of a sudden all the wires are gone. You have no water. And that's what happened with this lady. The bladder is not messaging, telling her to empty, release your muscle tone, let the urine out, because there's no electricity anymore. The nerves are gone. So that's why she has to catheterize herself, because there's no way for the bladder to empty. It just keeps filling, 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 but she can't release it unless she puts a catheter in and drains it out manually. So
And the bladder
it's,
tests you had, they were all
I'm
normal.
sorry,
The bladder
say
tests
it again.
the bladder tests you had were
Yeah.
all normal. But let me read to you this one section because I'm wondering now as I hear you talk, it might be related to it. She also had a lumbar MRI, and she had desiccation from L2 to L3 down to mild and severe on L3 and 4 and 3, 4, 5, space narrowing. There's lots of things happening in all those L2s and L3s and L4s. Would that have anything to do with that wiring?
It's hard to say. There's a lot of stuff happening in a lot of people's L2, L3, L4, and they don't have this.
Okay.
I think that it sounds like she probably went to a urologist, I'm guessing, right? Because urologists are the experts in this. It may, if she hasn't gone yet, it may. First of all, it's a difficult problem. Most people who have neurogenic bladders, it's very difficult to overcome it. In addition to this, she's had a lot of disease in that area. It says she has endometriosis. For the listeners who don't know what that is, that's uterine tissue, uterine lining tissue, which is spread all over the place. It escaped the uterus and is growing on nerves, it's growing on the colon, places it shouldn't be. How do we know it's not growing on the nerves that are going to the bladder? It may be. It may be. It probably is. So there are all kinds of these complications that are difficult. I would say I'm not sure that I have a good answer for her. I think that if she hasn't gone to her neurologist yet,
She has.
she should go to a neurologist. If she's only gone to a urologist, because you have to remember the urologist is the expert with the bladder, and that's her problem. But if something is pressing on a nerve from her spine, like you said, a neurologist would be a better thinker about that, not a urologist, to maybe think outside the box to see, huh, should we go in there to evaluate her nerves? See, a urologist is not good with that, generally speaking.
Yeah.
So, in any event, it's a chronic problem. I don't believe it's something that diet can basically overcome. I will say this. I would, if she has any excess weight to lose, I would definitely lose that, because having visceral fat in your abdominal cavity certainly doesn't help any disease problems that are going on in your abdominal cavity, like neurogenic bladder, endometriosis, or stuff like that. The other thing I would say regarding her is it sounds like she still takes blood pressure medicines. I would start asking why, because for the average person, I'm not saying every single last person, but for the vast majority of whole food plant-based people, they shouldn't be taking blood pressure medicines anymore. So I have found usually if I find a whole food plant-based person who's still on a blood pressure medicine, it means they can still kick up their game a notch to get off that medicine. And who knows, maybe that would help her with other problems like this, and maybe with her spinal nerves and stuff like that. But in the meantime, it is a difficult problem. And I have no specific ready solution for her other than to continue digging until you've like from a neurologist and you've reached all the experts, and there's nothing more to be done.
Okay, those were some good suggestions for her. That'll be helpful. It was news a 30-day outpatient intensive lifestyle intervention on cardiometabolic health. Can you tell us about that?
And so that is we are very proud of that. So that is my practice. That is our Ethos Primary Care patients. Over the last 10 years, those are all the patients who did the what we call the 30-day detox, or 30 days, and then went on beyond that eventually with lifestyle change to promote their health. And so that's about a decade's worth of data in there. I believe it's almost a decade of all the patients and what happened to them. What happened to their inflammation? What happened to their blood pressure? What happened to their risk of getting a heart attack and stroke? What happened to their diabetes? What happened to their, and it showed it was such a powerful experience clinically that the International Journal for Disease Prevention and Reversal printed the data from all of our patients. So yes, we're very proud of it.
Well, I'll put that link in the show notes below, and others can look
Yes.
at it because it was pretty profound. This one's from Clyde. He says he's 69 years old. He's been whole food plant-based, low oil, low sodium for 4 years. He was first diagnosed with type 2 diabetes at 46. He's 69 now. I'm wondering if, in addition to a whole food plant-based low oil lifestyle, there is any justification to other treatments to lower blood sugar. I get a massage every 4 weeks and that seems to help. And I've been wondering about acupuncture. Is there any evidence to support that it might be helpful in lowering blood sugar?
Does he say what so he said he's had it for 4 years, right? I'm sorry. He said he's 69. For 4 years, he's had the diabetes.
No, he's had diabetes since he was 46.
And what was for 4 years?
Whole food plant-based, low sodium, low oil.
And he doesn't tell you whether it's improved it.
Oh, he did say that. He said, I've had some success in getting off diabetic meds, but I'm curious about the acupuncture.
Okay. Does he say if he's off all medications?
He's not.
And I'm guessing he infers from his question that he still has diabetes.
Mm-hmm.
Do we know how much he weighs?
He's lost a lot of weight.
Okay, well, I'll go ahead with the information I have. So the question is, I think that you have to start off with this kind of patient. And this is the way I start off with all the diabetic patients is, can you get rid of your diabetes? Can you cure your diabetes? Can one day you have the potential to call yourself a non-diabetic patient? And it's important to know that, because if that's possible, because I think that most people who have diabetes want to be in that position. They don't want to have diabetes anymore at all. So how can you ascertain that, if that's possible? Well, I think the common way to ascertain it is to see if your pancreas is making enough insulin. Like, did your pancreas go out of business after all these years? Is it not making enough insulin? Because insulin is the hormone that gets sugar out of our bloodstreams and normalizes it and pushes it into cells to be burned as fuel. So typically, people who have burnt out pancreases, where they're highly insulin resistant and not producing enough insulin anymore, no, the answer is no. They don't have the opportunity to not be a diabetic anymore. So the question is that true of this gentleman? We don't know. So I like to, in all long-standing type 2 diabetics, I always get this test to see if they have the potential. And most of them do have the potential. they do, it's called the C-peptide test. It shows you how much of your own insulin do you still have that's being manufactured. So that would be the first thing for this gentleman. Are you still making your own insulin? And if you are, that means that theoretically and philosophically, you can be a non-diabetic just through lifestyle habits, not availing yourself to other things like acupuncture and massages or whatever he mentioned. I am not I don't know every piece of data in the world. Um, I am not aware that this is a major thing, that acupuncture can significantly decrease your blood sugars, nor can massage. Certainly not to the significant degree that eating food and exercising can, and even sleep. Those are lifestyle medicine behaviors. So I would say to this gentleman, if you're really interested in becoming a non-diabetic and not taking any medicines and not having diabetes at all, as long as you have a C-peptide level that's adequate, I would focus all of your energies on perfecting your eating of whole plant foods and your exercise and your sleep and your mindfulness, all the things that lifestyle medicine is. If you want to ask me about that, Kathy, I can review each one of those. But the bottom line is they're the most powerful things. And when I say powerful, what is the most powerful? The most powerful is to do these things at a high level. What does high level mean? High level means without moderation. It means without moderating. Like, for example, I noticed in the question, he said low salt. No salt. I noticed he said reduced oil. No oil, right? Most of us, go out to eat in a restaurant, right? What do we get if we're whole food plant-based, you eat in a restaurant? You get oil and salt. No moderation would mean not going to eat in restaurants. Like that kind of thing. I think that the people who have the opportunity, if you find yourself stuck and you'd like to go further than you have gone, I'd look to those avenues because they really work a lot. And I'm not so sure acupuncture and massage is going to help you that much. And I know those will help you a lot.
All right, so this next one has to do with 3 questions about LP little a. First of all, can you explain for our group what is LP little a?
Yes, LP little a is a very popular marker these days. It's been around for a number of years, but I see it rising, and I guess people are talking about it on the internet in its awareness, people's awareness of it. And what it is what I tell patients it's the genetic. I've inherited the predisposition, the test that shows whether you've inherited the genetic predisposition to get heart attacks and strokes. That's what it is. It's a genetic kind of test that shows, are you at risk more so than the average person to get heart attacks and strokes based on your inheritance? That's it. Yeah.
Okay, and I've heard you say, at least I think I have, that when you work with your patients, you test them for LP little a. And why would you do that? And what kind of things do you find?
I do that because in a large minority of people, we find it elevated. I would say the majority of people not elevated. I would say there's a minority of people that have it very low. There's a maybe about 20% of people have it really low. Maybe another 30% or 40% of people have it okay, like you're not you have significant risk. But maybe about 40% of people, 30 or 40%, I think, of the people I see have elevations of it. And so this would mean that unless they change their behavior, they are genetically at risk more so than the average American to get a heart attack and a stroke. That's why I get it. And so I'm not a big fan of just getting tests to show people, oh my God, you're going to die. Oh my God, because what's the point of that, right? Oh my God, I have having something fatal. Uh, it's a doomsday test. What's the point? However, if I can get something that shows a patient a vulnerability, which can be avoided and they can transform themselves and steer clear of this vulnerability. Oh my God, then that's a beautiful thing because this knowledge of that can drive a patient's behavior. So that's why I get it. And sure enough, we have patients in our practice who can drop their LP little a, depending on how dedicated they are, by half, by 50% in general.
Wow.
So,
fantastic.
yeah.
It's really good.
Just by eating. So, which goes to show you that, and then you're thinking to yourself, whoa, 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 whoa. You said this was a genetic test. How can what I'm eating give me different genes from my mother and father? That doesn't make any sense at all. Well, I cannot, eating kale does not give you different genes, but eating kale can change the expression of the genes so that they can alter the way they function, turn themselves on or off. And that's what we think is going on. When you you improve your lipoprotein little a from eating. There is also eating well. My friend, Dr. Goldhammer, who I'm sure you're aware of, right?
He Zoomed with us in January.
He talked with you in January. Did he talk about lipoprotein little a?
Not very much. No, that's why we're asking you about it.
Okay. Well, I'll talk for him right now.
Okay, good.
He has a recent fascination with it in the last year, and it's because he has noticed that he has a number of patients who have reduced their lipoprotein little a by water fast. And this is beyond the eating. And he thinks that there's a possibility that this may be that the water fasting may be an additional tool that can further increase the elevated lipoprotein little a levels, even beyond what's the good eating. We're testing this out with him in our practice.
Oh, great. Good. Well, we'll be anxious to hear about that. In fact, with all those wonderful results by whole food plant-based and also this new little tweak with Goldhammer and fasting in you, one person, Linda, says, though, but what about this new LP little a medication that now has FDA approval and is set to be released soon? It's called lepodisiran. And then there are 4 others in various stages. What do you think about meds for LP little a?
Well, it's what I think about meds in general. There are certain philosophies, there are core beliefs that all of us in our lives hold fast to, right? Like you, Kathy, you have certain beliefs based on your life's experience and education that you know are true. And this is what I know to be true about medications. You ready?
Yeah.
And this is all medications, including new ones that are about to be approved by the FDA, or 4 more that are coming down the pipe. And the truth is that let me start off by saying that I do believe in modern medicine. There's a place for it. There is a place for newly invented drugs and procedures when these medications and treatments are addressing a problem and providing a solution that can not otherwise be provided in a better manner. So, and if there is no other, if the patient faces a serious consequence from not taking the drug and there is no treatment, but based on what I just told you, there's an amazing treatment. 2 of them, eating whole plant foods and maybe water fast, maybe. And when you take one drug, it doesn't stop with one drug, because all this one pill is doing is it's knocking down little lipoprotein little a. But the thing that's getting it elevated is the chicken parmesan you're eating or something else, right? It's the food that's getting it elevated on top of your genes. So why not eat well so that you can reduce it? Now you may say to me, but Dr. Weiss, this patient is already whole food plant-based and she can't get it down anymore. Because I'm guessing that a lot of your patients, where a lot of your community is already whole food plant-based, who's sending these questions. And to this person, what I would do is offer reassurance. In the sage words of Dr. Caldwell Esses, your genes are the bullets loaded into the gun. What you eat pulls the trigger, or your lifestyle pulls the trigger. Can I change the genes? Can I give you new genes from 70 years ago from your mother and father? I can't do that. But just because the bullets are loaded into the chamber, right? If you have the safety on, the gun will never go off. Who cares? Just eat whole plant foods. That's the idea, that we are not victims or hostages to our genetic inheritance, that plants ultimately make us transcend who our genes say we should be in almost all cases, not in every single case, but in almost all cases, so that we can reach our potential. And that's the wonderful thing about plants. So the other thing you have to remember about drugs is they have side effects, because what a drug is it's one molecule that's manufactured 1 million, 3 million, 10 million times. How many millions of this molecule can they put into a capsule or a pill? And then you put it in your body. And this molecule is meant to go around to every one of your cells and snip or interfere with a biochemical intracellular reaction, or a chemical reaction somewhere in your body. But it's like going to a mechanic where you do a noise coming out of your car, and you get it, the car comes out of the shop, and he hands you some pieces left over that you took out. He said, "Here, these were left over. Your car's fine now." And you're thinking, weren't those needed? Like, didn't the car need those parts? What do you mean you took it out now and it doesn't need these parts? Something is wrong, right? There's something wrong with interfering with a biochemical reaction that Mother Nature has overseen for millions of years in us human beings. There's something wrong. because that biochemical reaction is hooked up to many other infinite relationships with other chemical reactions. And so once that's clipped, you will start impacting other reactions. And when those chickens come home to roost, they're known as side effects. And we know that to be true, right? Oh, an aspirin tablet. Oh, we used to think it was good to take. Oh, aspirin prevents heart attack. Everyone should take an aspirin. Oh, now it causes bleeds in your brains. Oh, everyone better stop taking the aspirin. Vioxx. Oh, it's really good for your knees to help you. Oh, it's killing people. It's causing heart attacks. We didn't know that. You know, Cipro. It's a good antibiotic. It kills her. Oh, we are seeing now it's rupturing your Achilles tendon. They're always, you're always waiting for the other shoe to drop when it comes to drugs. So what I'm saying to this lady is, I wouldn't worry. I would just tend to your habits, eat great, exercise, know that your genes are not necessarily your enemy. And I wouldn't take that drug to lower my lipoprotein little a. I'd eat great. I'd go to Dr. Goldhammer, fast for a week. And then for our patients who are really, they must know whatever, there are other ways to make sure that you are doing well, and to surveil people in a safe way to make sure that they're not worsening as far as atherosclerosis, and they're like in our surveillance program. I wouldn't take these drugs.
Okay, what about, you were talking about aspirin, and we used to be told to take that. Well, what about, we have a member who's got bursitis now, and she needs to tamp down the inflammation. And so turmeric was recommended. Can you take too much turmeric?
You take too much of anything. There's an LD50 for everything, a lethal dose. 50 is a pharmacologic term. That so I wouldn't recommend taking more than the equivalent of a teaspoon of dried ground turmeric a day. I wouldn't recommend more than that.
Okay.
I mean, I know there are studies that show people taking a tablespoon, 5 teaspoons, whatever, but who knows what effect that will have over a long term. Plants are medicine. And as an old, ancient, wise person said, an ancient historical figure in the field of medicine, the poison is in the dose. Some things are medicine, but if you take too much of them, they'll become poisons. Like, for example, broccoli is healthy, right? But I could give you enough broccoli. If I was crazy, I could make you eat enough broccoli, it would kill you. Or if I took broccoli sprouts, which are very concentrated, highly concentrated in the most powerful isothiocyanate, that cancer preventing molecule we're always trying to get in cruciferous, right? In all the broccoli. That's why we're eating broccoli. We want to prevent cancer. If I just took 2 cups of broccoli sprouts and ate them per day, you'd be close to going over, hitting the maximum allowed safe level of this molecule. So plants are really powerful medicines, and we should always remember that. And just eat them, eat them in regard to them.
One of our members, Valerie, she was concerned about the birds that here in Florida that she feeds in a bird feeder, and with all the news of bird food. So she ended up quitting feeding the birds and got rid of her bird feeder. And she's wondering, well, should I have done that? Do I need to be worried about those birds bringing her bird flu?
I believe the avian flu pandemic is coming. I don't know when it's going to get here, but it's due to human beings' disruption of our work, of our environment. We disrupt and interfere with relationships, with the natural relationships of the natural world. And most of the severe viral diseases that are now part of our human lives come from our in the the relationships, the I don't want to call them unnatural, but the ill-advised relationships that we have with animals, right? Like all this stuff that you see with the measles and the influenza, right? COVID was thought to come from this wet animal market, right? In China, capturing animals, confining them. Bird flu, right? Is coming. Where is it coming from? Well, in chicken houses, and then it's in these concentrated animal feeding operations, these huge dairy farms where all these cattle are together. Now the cattle are getting it. Now the people who take care of the cattle are getting it. So now it's in wild birds. And the birds are, we have a beautiful reservoir not too far from the farm, which is like a wild nature sanctuary. And now it was closed because they have found dead birds here in New Jersey, just in nature, testing positive for bird flu, avian. And it is estimated that in its full force, when this, it's not when, it's not if, it's when this contagion arrives on the scene, it's thought that it will have a mortality rate of about 50%, that half of all the people who get it will die. COVID, we had 1.5 million people dying, right? Over about a year and a half or so. That was only a fraction of a percent or 1%. It was some very small number. This is half. So I don't know when avian influenza is going to be here, avian flu, but it's coming. And I know it's here in the environment. I think probably it would be best to stay away from birds, wild birds, if you wanted to be safe.
Yeah, thank you for that answer. And speaking of your farm, that pond out on your farm, are you going to do farm days this year in September?
So no, we will not. Okay. Our farm days, the enormous event farm days, yeah, that we would have annually, we are changing to have multiple, not just one event, but many events spread throughout the season. And so they're going to be smaller, like half-day events, stuff like that are more manageable with the same kind of wow experience. And so we're in the process of redesigning that now. So I would ask if anyone is interested, and we welcome everyone to come to our farm. We think that it's a very unusual place. It's a working 300-year-old farm that's been working every day of its life. It's been transformed through the centuries of its existence from a prairie to the breadbasket of the colonies to an industrialized farm to growing GMO Monsanto, corn and soybean, to now being 100% regenerative and organic. So that's it. And you can come and get to see this process. Or we have a farm market that is open every weekend throughout the growing season, and it begins probably in another 2 weeks or so. Our market will open and goes until almost Christmas, maybe between Thanksgiving and Christmas. And open every weekend, Fridays and Saturdays, and you can come. And if any of you are interested, come come to our farm market, and then we'll have events here during the year. If you want to keep up with us, I would advise going to our website. It's ethosfarmtohealth.org, and you can sign up for our Seedlings quarterly newsletter. That'll tell you everything about what's going on. And we even have a really nice weekly bulletin that comes from our market that tells you what's fresh and what's new every week it comes out. And it has great recipes in it, plant-based whole foods recipes, as does our Seedlings newsletter. And all these things are free. All you have to do is go to our website and sign,
Wow,
even if you're in Florida.
so at least we could get the website, I mean, the email, and then be jealous that we're not there to buy that food. Oh, it sounds great. Just wonderful.
Well, it's not so far. We have patients in Florida. It's
You,
not so far. It's only like what, 2.5 hours from Newark to Florida.
oh, that would be wonderful. Okay, well, I saw that on your website that you were starting to have something monthly, and I thought, oh, that's interesting. So
Yeah.
you're already working on that. That's great. So we'll put the information you gave to us about contacting you and getting connected with the farm. I think that more of
I will say this. So we have two websites. The one I gave you is the farm's website,
okay.
but the practice's website is separate. It is ethosprimarycare.com. So the way we're situated here is it's a 300-year-old, 342-acre historic farm, and the practice is in the middle of the farm in an this old farmhand's house. So it's surrounded by the field. So when the patients come here, they can see everything, all the plants growing and the vegetables and the medicine.
I think you are definitely walking the walk.
I'm trying. I'm trying.
Okay. Well, thank you. This has been so informative. I mean, I had some questions, but you went beyond.
I tend to do that, unfortunately, sometimes, too
No,
much so.
good answers, wonderful answers.